Now, health experts say ensuring that everyone can obtain the care they need when they need it, right in the heart of the community, is an essential aspect of primary health care. Joining me from New York for more discussion is Nana Eyeson-Akiwowo, co-founder and president of African Health Now, an organization dedicated to promoting and providing access to sustainable primary health care to communities in Sub-Saharan Africa. Nana, welcome to the show.
Thank you for having me.
So this year, the World Health Organization really emphasized the fact that the key to universal health care is primary access to care. So talk to us about why it's so critical when it comes to primary health care.
For us, I think primary health care, or combating things at that level, is critical to preventative health care, preventing larger issues from coming. What we find is that a lot of the participants in our programs, especially in Ghana and Nigeria, a lot of them have not seen the doctor in years, and you find that we focus on non-communicable diseases, hypertension, diabetes, and also prenatal care. And you'll find that so many of our participants have not gone to the doctor, have no idea about their status, whether they have high blood pressure, or if they do, how to maintain it. So our focus on that space is always because we want to be able to prevent larger issues from coming up later on in time.
So primary healthcare encompasses many services. What aspect of primary healthcare has your organization identified as some of the priorities in the communities you service?
We've identified non-communicable diseases such as hypertension, diabetes, early stage breast cancer, and giving women breast cancer awareness, and as well as focusing a lot on prenatal care. So finding mothers who are pregnant and also realizing that they've not gone to the clinic at all to find out the size, the status, the positioning of their baby. And so those are the things that we find, especially as we deal with a lot of market women in the villages that we support.
So how do you work on the ground concretely when you get into a community? Where does the process start and what do you do?
The process starts with us, with our community leaders. It's really important for us, as Africans, we are very community based. And so it's really important for us to go in and make sure that we're communicating with the community leaders what our goals are, what we intend to bring into the community. We set up within a 24-hour period a mobile health clinic in large marketplaces within a 24-hour period. And so for us, making sure that the community leaders, the women in the market also understand our goal and what our intentions are is a very key piece to us. We have program directors who are continuously on the ground, making sure that we have our finger on the pulse of what people need. And so that's kind of how we've focused our work.
And briefly before we wrap, what do you hope to see in the next 5 years when you look at the type of impact you've had so far?
I think for us, what we've realized is that as an NGO, we know that our role is in partnership with the government, is in partnership with corporations. And so what we hope to see is that as we grow as an organization and as we grow as a country, as a continent, that we can continue these immense partnerships that work together to kind of provide people with the access to free primary health care.
Wonderful, Nana. Thank you so much for joining us today.
Thank you for having me.
And that was Nana Eyeson-Akiwowo. She is co-founder and president of African Health Now.